All right. Hi, everyone. This is Scott McNamara with What's New in Adapted Physical Education. Today we have a really special episode where we're going to talk with some of the staff members at NCPHAD, which is a national organization funded through the CDC for building healthy communities for people with disabilities. Before we get started, I just want to wish everyone a happy end of the school year. I know it's a hectic time trying to get everything all together, so I hope it all runs smoothly. So today we're going to have Dr. Jim Rimmer, a professor at the University of Alabama at Birmingham and the director of NCPHAD, on here, and he's done a lot of research in our field and is a very well-known researcher and has been one of those key people to make an organization and pair it with something like the Centers for Disease Control. And then we also have Alex Martinez, the expert inclusion specialist for NCPHAD, who's also going to join us. So while listening today, my hope is that everyone listens and here's some different resources they can use through NCPHAD. Although NCPHAD makes something for adaptive physical activity professionals, period, they have a lot of things for educators as well. And if you actually go onto my blog, Alex was kind enough to share with me a whole thing of resources just for educators. Go check out the blog because he has a whole bunch of things like newsletters and all these different things that you can check out. So I'm going to get started. We're going to get started and with the interview, and they're going to talk about who they are and why they're with NCPHAD. But if you two want to give me a quick who are you and why are you working with NCPHAD?
Okay, I can probably start. So my name is Alex Martinez, and I work for NCPHAD as an inclusion specialist. Background is physical education and coaching different kinds of sports. I got involved with the military on coaching sitting volleyball, and that's how I kind of got introduced to the field of disability. So then I reached out to NCPHAD. They were the one they needed somebody with a PE background, so that's when I come in. I am the one that kind of manage the educator sector on our resource center, our National Resource Center. So that's what I do. That's how I got into this disability world.
Great. And my name is Jim Rimmer, and I've been in the field for over 40 years. I started back in New York City as one of the first adapted PE teachers in the public school system. And then from there, I went to Ohio State for a master's degree in adapted physical education, and then finished my PhD in 1982 from Texas Women's University. So, I had a well-rounded education and strong passion for promoting the health and well-being of people with disabilities, including children and adults.
Wonderful, wonderful. And how did you get involved a little bit more with NCPHAD?
Well, it's an interesting story. Back in 1998, a couple of years after the Paralympics, which was hosted in Atlanta, Georgia, the first Paralympics in this country, formal Paralympics, there was an incentive post-Olympics to develop some sort of a training center. And at that time, the word on the street was, let's look at potential opportunities for funding. So Newt Gingrich was the Speaker of the House in that era and put some money into CDC, which was in Atlanta, to develop a Paralympic training center. But unfortunately, what ended up happening was the announcement came out when CDC got a hold of it, and they made it more open-ended, physical activity for people with disabilities. And of course, that's been a passion of mine for many, many years, having the National Center, a one-stop center where people can come and learn about what this whole field is about. So we ended up applying and received the funding in 1999 and started the National Center on what we called then physical activity and disability. And then in 2012, we added the word health, so that we're much broader now than just physical activity. We do a lot of work in nutrition. Alex has a colleague, Rebecca, who does quite a bit of work in the area of nutritional needs of people with disabilities. We know that there's a tremendous gap in the literature, certain nutritional guidelines for people with disabilities who have inflammation or pain or fatigue. So there's a lot of work in that area. And we also are starting to bridge into something called mindfulness, and wellness, which we think could have enormous relevance to people with disabilities. So NCPHAD has sort of spread its wings over the last 19 years, and next year will be our actually 20th anniversary. So we're very proud that a major federal agency has made a commitment to this area, and we feel very much in spirit that our foundation is adaptive physical activity and all that you do.
Wow, you answered quite a bit in there, actually. So NCPHAD is this large organization, and I guess, my background with NCPHAD is I know some, I took a class where we used a book about the inclusive fitness trainer. I've seen you guys at conferences sometimes, and then I've used your website for a few different things. The one thing I used to use it or teach my class about was your aim-free manual. I kind of maybe want some more narrower things. You talked a little bit about research that you're doing and the different resources that you're creating. It seems like you all, and you can correct me, but it seems like you do this huge multitude of things, right? So how does somebody like a APE teacher or somebody else out in the community not get overwhelmed by the information you have, and kind of how can they utilize your information?
Yeah, so that's a good point. We, like Dr. Rimmer explained, we are very broad in terms of some of the resources that we have. We have five different target audiences. We have public health professionals, healthcare providers, educators, individuals and caregivers, and then we also have fitness professionals. And maybe the CIFT class that you took came as an effort of that target section. The way that educators or APE teachers can go into our website and look for information is by clicking on that tab that says educators. We also have a search button there that you can put a topic and something will pop up. We also have technical assistance, so you can, if there's something that you wanted to find, some information, certain adaptations about a sport or a skill, you can go online, chat with one of the inclusion specialists, and then we provide technical training, technical support that way. We also have an email that you can just bring your questions up, and we also have a 1-800 number set up that you can call, and immediately one of us is going to be able to answer your questions. And then if not, if you need more resources, then we can follow up with you with all the resources that you need.
Yeah, and if I could just add, I think what you're bringing up has been an issue that we've known about before Alex joined us in the last cycle of funding. When we started the center, Scott, we realized that there wasn't a one-stop place where people can go. So we decided in 1998 that the best way to approach this was to make this a paperless center where you could download fact sheets and different types of tools and manuals and things of this nature. But we have now matured to a level with Alex's arrival and 4 other expert information specialists where we realize now that for someone who's in education, they have very little interest in what a healthcare professional would want, or somebody in the disability and aging service sector, or a family member that has a child with mild traumatic brain injury and wants to encourage them to participate in some type of activity. So the center has sort of revamped itself, and it's gone through this almost like a paradigm shift where now we're just not a resource center. What we hope you'll see over the next couple of years is that we've actually now gone from being a resource to a practice center. So now we're all about trying to bridge those two. And what we mean by practice is that you have, anybody in the educational world has a friend in Alex, right? And doesn't need to get the 80 to 90% of the content. They can get a hold of Alex. He's got his own micro newsletter that deals directly with educators. If there's workshops that come out, he could do that. If somebody comes in and says, I've got a child, with autism, he could refer them to a specialization at ACSM hosts. So we have identified, just like you described, that the world who comes to NCPHAD doesn't need everything, and that it could be overwhelming in some respects. And now what we've done is we've almost made this like a franchise. So Alex has his own franchise. His role is unique. He could do whatever he feels is there to expand the field. Would you say that? Is that correct?
Yeah, absolutely. I think that's correct. I got the liberty to produce and put resources that disseminate resources that teachers really want. And there are different ways to kind of disseminate those, whether it's through our newsletter or micro newsletter, or sometimes in conference, we go to different conferences and we meet with a bunch of teachers. We also do some local community work, and I get a chance to kind of sit in different councils and just talk to teachers and ask them, what do you need? What do you need from the center? And that's a good way for me to come up with resources that are going to close the gap.
I'm going to ask a follow-up question to that. So what are some of the different resources that teachers and such are asking you to create then? And this podcast isn't just for teachers at all, but that does seem to be the majority of people that are listening to it.
So that's a good question. We actually partnered with After Schools, and we were able to disseminate a survey. We got about 742 responses of different teachers throughout the nation. That survey was asking about what are some of the needs. What do you need? And a lot of the questions that we received was needed more training. Also, they needed more help from the different districts, like not knowing where the AP specialist was going to be. How can they contact that person? Also, we got a lot of questions about adaptations. Teachers want to do the adaptations, but they may not know how to do adaptations in order to make the class inclusive. So we try to create resources that show how to do adaptations of different skills and sports. And some of my newsletter that is coming out focus on that. So if you go in that newsletter, you're going to see that I got different activity cards, how to modify different skills, how to come up with some strategies for behavior management, things of that nature. So that was a good partnership to be able to know some of those needs and put some resources out there that are actually worth looking into.
All right, you guys also talked a little bit about research and advocacy too. I know that you're all doing research and such. What are you doing? Research in the field of adapted physical education, or is it more broad towards that health component for people with disabilities?
Yeah, I can take that one. So, we weren't allowed over the last 19 years to do research because the CDC has two funding streams. They have a research funding stream and they have a non-research funding stream. But I think we've now got them to a point of, in order for us to move the field forward and to have an evidence base where people can be assured that what we are recommending has been tested, we've been kind of given a little bit indirectly some assurances that as long as you call it science or evaluation or translation, that they'll be okay with it. So our field now, our programs now are being developed with very, very carefully designed, valid, systematic adaptations. And one of the things that I've seen as an adaptive physical activity professional for over 40 years is that we've missed the science in adaptive physical activity to a large extent. My background is exercise physiology and adapted, and if you get into the exercise physiology literature, they've got a real good evidence base, don't they? If they tell you to do cardiovascular training, and if you do it for X amount, you see a dose-response effect. We need those same types of dose-response effects for people with disabilities, children. So if you take a child with autism, what is the dose-response effect of a basketball program or of an after-school program? And, if you go into our literature, sad to say that we don't really have it. So what NCPHAD now has is that we have something called the grades, which stands for Guidelines, Recommendations, Adaptations, Including Disability. And these grades were developed with a $2 million grant from one of the federal agencies. And now Alex is using those grades to develop adapted evidence-based programs. So in other words, there are many, many evidence-based programs on children, but there are only a couple of evidence-based programs on children with disabilities. And so what Alex is doing now is using this tool called the grades to be able to adapt programs. I'm going to turn it back over to him because he has a couple of programs that might be very appealing to your audience that now have been adapted for children with disabilities. Alex?
Yeah, so like Dr. Rimmer said, I'm able to use that framework to make adaptations of different programs. One of the programs that have a lot of success that we recently did is Girls on the Run. With that program, we were able to make adaptations so they can be incorporated in the curriculum. We came at a really good point where they were about to release the curriculum manual, and we were able to put our adaptations in the manual already. With that as well, we were able to run a pilot program here in Birmingham, and along with 14 other councils around the different states. And so we were able to also not only provide the adaptations to run the program in different states, and then get numbers and ideas and assessments and see how they success stories, see how they really were able to promote and use the curriculum that we provided. Another curriculums that we have provide adaptations for are Spark after-school program, and also the Catch early intervention program. So those are more related to physical education and recreational specialists. We have other programs that we have as well made adaptations for them, like a diabetes program by CDC, Weight Wise as management program. So there's a variety of programs that we created adaptations for, but mainly those three that I explained first are the ones that are kind of related to the physical activity of somebody, or just in school or in an after-school setting. Girls on Their Own programs is one that is already being incorporated. The diabetes prevention program, some states are using it, and then we are also providing training for that as well. So those two are currently going on. The other ones are more like the final stage.
Yeah, but I think your point is a good one, and that is we are revamping our website. You know, it was created organically by our information communication technology person, and we're going through a major overhaul using, you know, the newer and the better technologies. And when we do that, you know, a front and center goal for Alex and the other expert information specialist, Scott, is to really make sure that this is designed in such a way that if somebody wants a tool, if they want an adaptive program like the Spark program or Girls on the Run, it's very easy to find. There's a button where they can call an information specialist. But the other side of the research paradigm really is to get people to give us the evidence that these adaptations are working. So we really see research as a bidirectional flow of information. We provide the Girls on the Run or the Spark program to the community service provider. And what we hope will happen is they'll stay in touch with us and they'll give us this information so that we can start to build the evidence. Because unless we really look at this as a two-way street, you know, just sending information out and not having any response back, you know, will limit the capacity of our profession to really build the big science, a large science, which I've been referring to as inclusion and adaptation science. So we need to begin to use the term science behind APA. If we only say adaptive physical activity and we don't have that science at the end of the word, I don't think people are going to acknowledge that we do research.
And I think that actually transitions really well to the struggle that usually occurs in the school districts as well, of trying to validate our profession, which really just happens in like the physical education profession. And the more evidence we have and accessible evidence that we have to promote that, I think is excellent. I'm really interested, going back, I think, to the first thing that you started talking about. Was it GRADE? Was that the acronym you used?
Yes, it is.
Yeah, because to me, that GRADE system sounds like a really nice way that we can better advocate also for the field of APE and APA in general. And I really like what all the things that you do. I mean, you're, as you said before, you're one of the only organizations, if not the only and largest, that does what you do. You promote health for people with disabilities. And you do it all through providing resources and research, and you're also a huge advocacy piece. So, you know, I think all that information that if you want to share it with me, I can share it to my users as well, because it's so important in some of those key things. And so I'm going to lead that kind of to my next, and we can talk broadly and talk to the field of education, but what are some of your most popular resources that are coming from you all, and who exactly is using them?
The majority of our resources can be used by either teachers, paraprofessionals. We got resources for occupational therapies and PTs, recreation specialists, teachers, regular teachers as well. We have many resources, but I think some of the resources that are more broadly used in the field is the inclusive PE guidebook. On that one, we also have a training platform where you can go online and access an online training specific to that guidebook. We also have an inclusive guidebook on inclusive playgrounds, school wellness, and that was in addition of the NCPHAD program. So we created an addendum for that program, so kids actually can go out there and then get their 60 minutes a day that they need. So we know that in this field, it's really, really hard to get students to get 60 minutes a day. So, they might get 30 minutes of quality P, and then we have to come up with ways to be able to get them to those 60 minutes. So that's what we believe a lot of recess and brain boosters, things of that nature, and then after school, before school activities. So those are some of the good resources that we have. We also have some virtual resources. We have one that's called 14 Weeks for LTRU, and that's more on the health kind of side. But I think that there might be some use for PE as well, where you can go online, access this program, and then do exercises at home. And then there's other ways to do virtual training with another program that we have that is called TRX. It's a more high intensity kind of type of exercise, so you might need a few equipment at home just to be able to do that. But those are really good resources that we have. We also have a YouTube channel where we have a how-to series that kind of tell people how, that are new to a wheelchair, new using a wheelchair, how they can do some things, how they can go shopping, how they can communicate to their community vendor, how they can communicate to the doctor, how to drive a car. So those are really, really popular resources. Our newsletter is really popular as well. We have one that goes every month, and that one is more kind of like a general newsletter for all target audiences. And now we just started to come out with our micro newsletter that goes out every quarter. And those, the micro newsletter that goes out every quarter, the quarterly digest, that's what we called it, is specific to every target audience. So public health professional has one, fitness professionals has one, caregivers has one, educators has one as well.
I want to know a little bit too about so all these different resources you have, and you talked about how they're validated. How are you developing some of these? Are you, are you consulting experts, or are you you said that there's validation behind it as well?
Yeah.
Yeah. Well, I could just say from the early stages, we have contracted with some of the best people in the country, who actually run these programs. So we contract with them, we give them, a certain amount of funding, and then, our expectation is that they go into the literature, do what we refer to as a scoping review, and they identify, materials and resources that are either enhancing what they currently have or creating something new. So we always pick the best, the best people out there, and we do have that capacity.
Yeah, and we also have a panel of experts that we can go and talk to. So every target sector has at least 2 or more. And then I think we have 10 panel expert members, and half of them have a disability. So we're able to get real input on what are some of the things that we need, and we share those documents with them and these resources, and they're able to provide really good input on how to make them better, basically.
Yeah. So at the minimum, Scott, we get, expert validity, and then at the higher levels, if we have to do something like you mentioned, our manual AIM-free, which is measuring the accessibility of fitness centers, that was another grant that we had several years ago. So that was validated using very sophisticated methodologies. So everything we do has to have some level of evidence.
And some of these resources that we have, we make them in collaboration with some kind of partnership. I can think of maybe Exercise Connection. We did a video series for autism and physical education, and we were able to partner with Coach Dave, which is a kind of a really well-known person in the autism field. So he was able to help us, and then we were able to create video series that any teacher can go out and find on our website.
Wonderful. Are even the YouTube videos you're creating, are there still that validation process going on with those?
Well, yeah, anything we put on the YouTube, we ensure that whatever information we have has been based on a current study or some study which showed, okay, if you do X amount of minutes per day, this type of activity, this is done. But I think the bigger thing now is with these grades, guidelines, recommendations, adaptations, we've actually got a systematic tool now where we can do this without going into the literature. So, Alex has spent a lot of time, right, the first year doing this.
Yeah. It was lots of months of kind of getting the grades and getting the program to the grades to be able to come up with the adaptations. And then I think if in the future, probably not into that question yet, but I think that it would be good if people can actually get these grades and then do the adaptation on their own. Because I believe that every classroom is so different. The needs are different. The students are different. So that way they can adapt a program or a resource that is going to be kind of personal to their actual experience.
Yeah. This sounds so important to me. What you're talking about here, just with the that there's evidence behind what you're doing, because you're not only creating all these different resources, but a lot of the resources that we have created in our field a lot of times are teacher created and might work for one person and not the other, but you've created these resources that have some validity to it, which is also just really important for us once again when we're validating our field and saying this is something that has evidence behind it. And I think that's so important. I've had people that have come to me and talked to me before and just said that when they've gone and tried to promote a program to their special ed director or something like that, that they ask them where's the evidence before we do something, and they have nothing to show. So you're not only providing these resources, but also that you can say it's proven, that there's some validity behind it. That's huge.
And Scott, can I add one more thing to that? Because I think this is a critical piece for me coming from the world of science, being a researcher. The adaptation model that we've now created is called NCATS, NCPHAD Knowledge, Adaptation, Translation, and Scale-Up. So there are 4 parts to it, which are, I think every adaptive program in the country should be looking at this, because it's the most valid, systematic way to teach students how to adapt programs and services and whatever they're doing in their community. So that's going to all be part of the new website. Right. And I think it's a critical piece that has been lacking, in my opinion, from our profession for many, many years, maybe even decades.
I think we should share some of that information, since you two are experts in it more than anyone else. Tell us a little bit more about this grades and about this adaptations curriculum evaluation system you've created.
Yeah, I think it's, what breaks my heart is when I see so many universities around the country, Research One universities, actually take positions away from adaptive physical activity and give it to exercise science. It's because they're trying to get they're trying to bring federal funding in, right? And here we're sitting on a field which has now been created called implementation science. What is implementation science? It's the ability to adapt programs in real world settings, right? And along with that, the medical world has figured this out, and now they've got something called precision medicine. And what is precision medicine? It's you take all of the elements of a person's genotype, right? We've got now the DNA mapped out. You take DNA, you take their behavior, you take their environment, you take their physiology, and you put it into a big data system, and you come out with more precise prescriptions, medical prescriptions, or treatments for people who have various chronic diseases. So the model is laid out now for adaptive physical activity because, as Alex said, 2 children with autism in 2 different settings could have very different results with the same adaptations, right? But what the grades does is it allows you to keep adding adaptations or to take out different adaptations in these 5 domains of the built environment, equipment, the services, the instruction, and also the overarching policy, so that you've got a systematic way of doing this. And I just want to mention to your audience that research can be done. Somebody might look at this and say, well, I'm just an adaptive PE teacher. Well, no, you are a researcher. Research just means that you're trying to advance science in some systematic way. There are case study journals now where you can publish a paper on one participant with autism. So we need your audience to understand that Alex is waiting to hear from you. He's waiting to see what kind of adaptations to have. He's looking in his archive of adaptations to see if those exist. And if somebody's doing something that's really successful, he's going to archive that by their name and by the person that they work with. We don't have to identify who he is, but he's going to say it's a child with autism, 10 years of age. That's how you build the adaptive physical activity science, so it's not subsumed by another group of implementation scientists using what we call adaptations, right? We should be getting more of the NIH funding because we know how to adapt it. Unfortunately, we didn't build a science under it. Now we have the science. We need people to come to NCPHAD, to speak with Alex, to understand what he means by this term adaptation science, and then he can work with them on developing the infrastructure for them to be able to test it in their own community.
All right, thank you so much for joining us again on What's New in Adapted Physical Education. And we are going to have another second podcast with Dr. Rimmer and Alex again coming very shortly. And then after that, I don't have any podcast on the books, but that probably will be changing very shortly. So also, I'm finishing my dissertation at the moment, which is this, a very well-known crazy time in one's life. So if there's a small hiatus between the next episode and the one after that, no angry emails, please. I'm just trying to finish my dissertation, which is on July 11th for my defense. So very exciting. All right, everyone, have a great day and enjoy the end of your school years.